Hey guys, thought I'd practice for an upcoming podcast that Eric and myself are putting together. So figured I'd put this video together and get a chance to practice my editing and working with the soundboard here and work with the lighting and see what works and what doesn't work. I didn't want to make a bunch of short videos like test on it and stuff like that. So I figured I'd take this opportunity and talk about um, a personal issue of mine. Um, the guys that know me or the people that know me, the last few months I've had some serious, serious stress, and not going into the main one, but one of those issues was a medical scare that I had. Um, yeah, I've kind of been dealing with for a few years in one way or another. So, um, you know, I'm hoping to make a video that's helpful, to guys my age. The older you get, the more issues start popping up and stuff. So we're going to talk about some medical issues that I had, and I just got to give out a disclaimer that I'm not a doctor. People know me. I'm not even close to being smart enough to be a doctor. But a lot of the stuff we'll be talking about is research I've done, on the internet and talking with my doctors and you know, and just kind of giving a recount of my experience through all of this and stuff. I mean, again, I have zero medical training. I've gotten some tactical EMS stuff, throughout my law enforcement career, but it has nothing to do with what I'm about to talk or discuss now. Um, so just to give you a preface, back in 2020, I started taking testosterone replacement therapy, you know, um, and that's a whole nother subject. But part of that, being prescribed that, I have a responsible doctor and he does all sorts of labs on me and, you know, tests me, aside from the lipid panel that I get from my cardiologist and, all that other stuff. One of the things that I get screened for is PSA levels. So PSA stands for protein specific antigens, and it's a way that they screen for prostate cancer. So I had no clue what any of this stuff meant and stuff like that. So the first time I had issues where there was a question about my test results, I started, digging into it and stuff like that, trying to figure out what it was. So for those of you guys don't know, the prostate is a small gland in the male reproductive system. It's located below the bladder and surrounds the urethra. So its primary function is to produce fluid that mixes with sperm to form semen. Some prostate health issues like enlarged prostate or prostatitis can affect urination and sexual function. So, some other things about the prostate. So, it's just a small walnut sized gland that surrounds the tube, that leads from your bladder. So, the older you get, the larger it increases in size. So, it kind of, chokes that tube smaller and smaller and stuff. And guys, that's why you have guys like my age and older. They have to get up a couple times throughout the night to go to the bathroom, and it becomes a hassle and stuff like that. So, and a large prostate is it's called BPH. It stands for benign prostatic hyperplasia. I know I'm murdering the pronunciation on that, but BPH. Um, Prostatitis is inflammation of the prostate, and then you have prostate cancer. So those are some of the common issues that men suffer when they have issues with their prostate. So an enlarged prostate can cause urinary issues like frequent urination, difficulty starting urination, or a feeling of incomplete bladder emptying. Prostatitis obviously causes pain, fever, and chills. So with BPH, so one of the if you're on testosterone replacement therapy, one of the things that could happen is it could affect the prostate, meaning it cause BPH. So enlarges the prostate, because of the amount of testosterone, um, in your system now, So And having a large prostate, can cause some issues and stuff. So the test for the PSA, it's a blood test. They measure PSA levels in your bloodstream in nanograms per milliliter. And the amount, depending on your age, you should be in a certain range as far as your age group and stuff like that. So this your prostate, produces this protein, and it does leak out into your blood system. And obviously, the larger your prostate is, the more of these proteins are dispersed or leaked out into your blood. So, and those levels will show up on your tests and stuff. So, um, another form of screening for prostate issues is a digital rectal exam. So digital rectal exam and your PSA blood level test, those are the two main tests, initial tests that you get, once you start getting issues. So obviously the digital rectal exam, the doctor will, go in the hard way, and check your prostate and check for nodules and lesions, and, and actually test for the size of, feels for the size of your prostate. So, just to recap, the PSA test is a blood test that measures the level of protein produced by the prostate gland. It's a blood test used primarily to screen for prostate cancer. So levels, PSA levels in men can be elevated for a number of reasons. And one of those reasons is prostate cancer. So, when you go in for your labs, or when your doctor says you have to go in, hey, listen, we got to do some labs. He's going to let you know, hey, listen, aside from fasting the day before, for your prostate, your PSA, he's going to want you to discontinue any sexual activity for at least 5 days. Because if you have sexual activity like the day before, it's going to increase your PSA levels. So that's one thing to be thinking about. And there's a whole list of things that you're not supposed to do. Riding a bicycle, that pressure in underneath your groin area, that can cause your PSA levels to go up, or heavy lifting, working out and stuff. So, and some of these things aren't explained by the doctor. The main thing is, hey, listen, don't have sex or any kind of sexual activity 5 days before the exam. So when you do have a blood test, so say you get an elevated PSA levels, well, it can be a sign of prostate cancer, but like I said, it can also be caused by other issues, BPH being one of them, sexual activity, or not listening to your doctor prior to taking a test. Those are just some of the things that could be a reason for your PSA levels to be high. And then it's up to your doctor to figure out how accurate is that test, because the PSA test is not, a definitive test if you have cancer. And, so what happens if the results are high? Well, PSA level is high, a doctor will likely recommend further testing, such as the digital rectal exam or imaging tests like an MRI, or, worst case scenario, biopsy. So just kind of give you an idea of what the levels should be, when you get your test. So guys 40 to 49 years old should be below a 2.5 nanograms per milliliter. That's generally considered normal. Guys like myself, between the ages of 50 and 59, I'll be 55 this month, level is about 3.5 nanograms per milliliter. So you notice the older you get, the higher the number is going to go. Well, an acceptable number as far as your ranges go. And obviously 60 to 69, now we're looking at 4.5 nanograms per milliliter. So to kind of give you a history where I was, so the first time it became an issue for me was in September of 2020. So I scored a 5.19, so that's obviously well above the normal range, which was 3.5. So, my doctor at the time was like, well, let's retest. You might have an infection. And having an infection, is another reason you can have a high PSA level. So I ran a course of antibiotics, and I came in there a couple weeks later and retested, and I was back down to 3.6. So now I'm back to a normal range. Even a year later, December 21, I was at a 3.8. And then in 2021, I went through the ordeal of having kidney stones. If you never had kidney stones, I don't wish that stuff on people I don't like. It's a horrible experience. But because I dealt with kidney stones, now I have a urologist involved, and he's looking at my numbers as well. So a urologist will also be testing for your PSA levels. And, so he noticed, because he obviously looks at my records from before from other doctors, and he saw the high one and then, went back down to normal. So he knew, that's something he needs to be checking. So, of course, follow-ups and stuff like that. So, July 2022, again, I'm high. I'm at a 4.36, but my doctor, knowing that, I'm kind of all over the place, and with the enlarged prostate, he wasn't too worried about it. So he's like, let's test it again, So, the following month, he tested me again, and now, it lowered down to 4.17. So it's still, in the high range. It's above the 3.5 where I should be at. And he was like, hey, listen, let's just, it's not invasive as a prostate exam, but let's try an MRI. So some imaging and, check out my prostate, which they did. They stick you in there and, they do some scans. And the way your test results come back, it's called the PRADS, PIRADS, and they rate you from 1 to 5, 1 being that, there's no problems there, and 5 being, hey, listen, you better do a biopsy. But, when you're at a 5, there's obviously other signs, like nodules or lesions on your prostate, aside from the, having BPH and a large prostate. So August of 2022, after that MRI I took, I got a scoring of a PRAD level 2, and that translates to, it says cancer unlikely to be present, which, myself and my doctor were like, oh, okay, great. Let's just, monitor this thing. And, there's nothing that we can see so far as something to worry about on my prostate. But, fast forward to the following year, February 2023, again, I'm back down to a normal range. I'm at 3.69. Again, good news. But they're going to keep monitoring. It's going to be a yearly test, or a fairly frequent test. So, the following year, following February in 2024, I was back up to 4.12. So again, my urologist, is just like, you're normally all over the place. Let's not worry about it. And, we'll test you next year. You know what I mean? So, going back to the whole prostate cancer thing, any kind of cancer is obviously scary. You hear that word, I can't imagine, what it's like for people who've had that conversation with their doctor, and, then you have to deal with it and, the treatment and stuff like that. But with research I've done on prostate cancer, and people have said this to me before, if you're going to get a cancer, prostate cancer is probably the one, you know what I mean? If you're unlucky enough to get that, diagnosis of cancer, prostate cancer is the one you're going to kind of, hope for, because it has a pretty high survival rate, so I mean it's well into the 90%, so but you'll still have issues and stuff like that. You know what I mean? So, and there's treatment involved, and we'll get into that. But even though my test was a little high in 24, they weren't worried about it. So, here we are. I just had a test in January of 2025 this year, and I was pretty high. I was at 5.66. So, that obviously set off some bells with my doctor, and myself included. I'm just like, because that's the highest I've ever been. You know what I mean? We're going from 3.5 where I should be up to a 5.66. So, got a little worried, and I was like, well, let's can we rule out infection or anything like that, and my doctor's like, okay, let's run a course of antibiotics, which I did, and I remembered all those things I'm not supposed to do before the test, no sexual activity. I didn't work out for a week. um, I tried to limit the amount of red meat I ate because, again, eating too much red meat before a PSA test can show some elevated levels. And I came back a couple months later, and I was still high. I mean, it did drop. It dropped to a 5.4, and again, it was lower than the previous month, but still, it was well above where I should be. So, the doctor, my urologist, suggested that we should do a biopsy. Um, and let's try to get some definitive answers, and see where we're at, and then we'll deal. So the biopsy test that involves um, there's no way of sugarcoating this. They go in the hard way, the same way they do a digital rectal exam. So, taking a biopsy, obviously so the biopsy is they go in there and they take a needle and they take samples from 12 different spots from your prostate. And so you go in for the procedure, and it's uncomfortable. It didn't hurt, but I don't normally, I don't live a lifestyle where, I have things inserted into my rectum on a normal basis. So it's uncomfortable. So, and it's kind of a daunting thought, when, because the doctor explains it to you, before you even set up your schedule, biopsy. So they're going to go in there, they're going to take a needle, and first thing they're going to do is inject a numbing medication to numb your prostate. And then, they'll take samples from 12 different spots off your prostate by use of needle. So, and that sounds pretty scary. And just kind of give you like a reference point, they take your vitals, they don't put you under for this. You're awake through the whole thing. And they, take your vitals, and, my blood pressure, just show you how nervous I was. I think it was a 162 over an 89, so my blood pressure was high, so, I got a great urologist. So he was just like, just try to relax, and, we'll figure this out together and stuff like that. And we'll do what we have to do. So they're laying on the table, and, honestly, I didn't, aside from that thing being shoved into my rectum, you don't feel the needles, I mean, and he's letting you know, he's like, all right, you may feel a little burning, but I didn't, what I mean? So, and then after that is just a series of clicks, so it's 12 clicks, and that's the needle going to these different spots of your prostate, and, taking samples. So you'll hear a click, doctor list off, what section, and then the nurse or the assistant that's there is, is writing all this information down, and doing a lot of note taking and stuff. So they know what area they got that sample from. Because when you do get your when you do get your results back, it's per the section that they tested. You know what I mean? So you'll all get it on one result sheet, but it'll list off where they got the sample, if there's an issue and anything like that. So I took the test, and you're done. You drive home. Like I said, they don't put you under, so you don't need somebody waiting there to drive you home and anything like that. And then like the aftermath of that test, obviously you're gonna have some blood in your urine and your stool, um, and even in your semen. You know, what I mean, you can continue regular sexual activity. He said after 5 days. You know what I mean, and but you can see some blood in your semen. Up to 2 weeks. Is what they're saying. As far as the urine went, I think it was probably the fourth or fifth day. You don't really see a lot. Now, you go back to like when I had kidney stones, and they had to go in the hard way to get those out. You know what I mean? Where they go in through your penis, up into your urethra to break up the stone and yank them out of there. I had a large amount of blood for days after this. For the biopsy on my prostate, it wasn't. It was barely noticeable after the second day, but you do see remnants of blood in your urine for a while. So and the doctor tells you, it's going to be 3 to 5 days before the results come back, because obviously it's got to go to the lab. The problem with that is, guys like myself who have MyChart, and MyChart will give you a notification saying, "Hey, listen, your test results are in," and I know I shouldn't be looking at these test results until I talk to the doctor, because, I don't know what any of this stuff is going to mean or whatever, but of course, I'm pretty stressed out about this whole situation. So of course I looked at it, and and they list off the 12 different areas. It as soon as I opened up, the MyChart app on my phone, I was already worried, because right next to prostate biopsy result, it has a big block. It says abnormal. So I'm like, God damn it. You know what I mean? What's wrong? You know what I mean? So, um, that definitely sent chills down my spine, because, I'm scared. I'm not going to lie to you. It was pretty stressful seeing that word pop up on the screen of my phone, abnormal. You're just like, okay, the test results weren't clear. So you go through all these different sections, and most of them said the same thing. No, um, you know, no cancer detected, or I can't remember the name of it, but no carcinoma detected or something like that. And then there's like two sections, and the one that caught my eye was it says atypical small SNR proliferation, and there's an acronym, ASAP, ASAP. You know, and you look up at you look that up, you Google that shit, and when it talks about people who have this, will eventually develop cancer. So I'm freaking out. I'm like, this is something wrong, and now I'm looking up treatments and stuff like that. Um, because here's the thing with prostate cancer. If you get diagnosed with prostate cancer, the one of the practices that doctors have is, okay, we're gonna remove the prostate. Um, you know, remove the prostate. You don't have cancer in you. This is what has cancer. Well, let's remove it. You don't need it to live. The problem with that is, your prostate, controls, your urinary function, and, a lot of your sexual functions as a man. You know what I mean? So that comes with a lot of drawbacks. Um, Most men, if they get their prostate removed, um, you know, you're not going to get any feeling down there for at least 18 months, meaning no erections, means wearing a diaper, because, your prostate controls, your urinary function, and even after then, you could be in a diaper longer because, as you're learning to, control your urinary function, whatever Kegel exercises, to help you teach your body to stop and, start, urinating. Even when you got that down, you're still going to have leaks, because every time you cough or sneeze, you're wetting yourself. So you got to continue to wear a diaper for a period of time. And then some men don't get any feeling down there as far as, you're going to have erectile dysfunction. You're not going to be able to get erect, because your prostate is a big part of that. And, I'm not going to lie. I did not want them to remove my prostate. Even if I got a horrible diagnosis, that wasn't an option that I was going to look into. So I started looking into other treatments. There's proton therapy where they insert these little radioactive seeds in your prostate, and become all radioactive and stuff. And but it treats the cancer that way. And then there's radiation therapy, chemo. There's a couple other treatments out there, but the go-to, like I said, depending on how bad the cancer is, they're just going to remove your prostate, and the thinking is, hey, you're alive, but then obviously your quality of life is just, at least my quality of life would definitely go down, if I didn't have regular sexual functions, so so I'm dealing with that, that day, reading those results. And it wasn't until the next day, then, I get a message through my chart from my doctor. And the doctor's like, oh, hey, good news, I have cancer. So I'm just like a little relieved. And he's like, hey, I have cancer. Make an appointment for a follow-up. And luckily for me, I was able to come see him the next day. And, because I still had questions, what now? I mean, what is this abnormal reading that I got on my test, so go to the office, and now he's, telling me, he's like, hey, listen, there's no prostate cancer there. What it did detect was some precancerous cells, and, 20 to 30% of men, will eventually get prostate cancer from this, but it's a low grade cancer, and, we could deal with it, and now I'm feeling a little more relieved, because now that opens up, a lot more of these other treatments that I talked about, as opposed to, just removing the prostate altogether. So, so the follow-up, or the, the recommended treatment for that is, follow-up follow-up tests, so 6 to 8 months from now, I'll be scheduled to go in for another PSA test, and possibly an MRI, to do some more imaging and stuff like that. The problem with the MRI, as it was explained to me, is that it doesn't take, you're not able to look at the whole prostate. Now you're getting a good view of it, but you're not seeing everything. And that's where the biopsy comes in, because now you're getting, samples from all these different little sections and testing them individually and stuff, and being more specific in your research into, what you got going on. So, I'll, as of right now, I'm pretty happy with where I'm at. I'm still concerned with the results, and I plan on keeping you guys updated if you guys are interested enough, and knowing what I'm going through and stuff. Like I said, I'm not, this video is mainly just to practice for the upcoming podcast. I know I got a long way to go as far as learning how to talk to people or talk on a camera. But, I think a lot of guys my age, might find this useful, you know what I mean? Or women who, their husbands or boyfriends, they may or may not be going through this. I think it'd be good information, to kind of see what I went through and the stresses that I dealt with. And kind of give an idea of what to expect, if you get a bad PSA level. So, um, I'll keep everybody posted, and keep an eye out for our upcoming podcast. I hope this helps, and I appreciate you listening and clicking on this video and listening to what I got to say. And I'll see you guys next time. Thanks.